Now let's talk about risk factors for Alzheimer's disease. There's some avoidable risk factors and there's some unavoidable. We'll start with the unavoidable. Number one risk factor is age. I wish I could avoid aging. Maybe you do too, but you can't. And again, this fits perfectly with the new perspective that Alzheimer's disease is a process of aging, accelerated by certain death factors and slowed down by certain life factors. But aging is the number one risk factor. If you want to avoid Alzheimer's disease, die at 50. Very low chance of getting Alzheimer's disease. If you make it to 85, like I just said, about a 50-50 shot. Make it to 95, almost for sure you'll at least have the memory loss of Alzheimer's disease. Other unavoidable risk factors are family history. If you have a first-degree relative with Alzheimer's disease, your risk is about 20% higher. The more first-degree relatives you have, the higher your risk goes. Now, about 25% of the family history risk is chromosomal. There's actually a chromosomal issue going on. But this other 75% isn't specific to the chromosomes, but it definitely does run in families. Other risks include developmental issues. For example, Down syndrome have a high increased risk of Alzheimer's disease. Mental retardation. Now this fits stage 1, preparation, which is the development of your brain. As you remember, if you don't develop as many cells to die, you're going to have a dead brain sooner than another person. So people with limited brain development because of a developmental disability have a higher risk for Alzheimer's disease. Other unavoidable risk includes unavoidable head trauma. In other words, you get in a car wreck. The soldier's coming back from the war. Head trauma, when your head gets banged, cells definitely die. Most of the factors, though, that really associate with Alzheimer's disease are avoidable. They're factors that you can intervene and make a change so they do not cause your brain to die too fast.